Good morning. So, in continuation to our plasma volume expanders, so last part we have seen about their ideal properties. What is that we have discussed? Now, plasma volume expanders, it can be classified mainly into the two classes, that is the crystalloid and the colloid. The crystalloids are the aqueous solution of the mineral salts or other water soluble molecules like normal saline, dextrose, Ringer solutions, etc. And colloids are the large insoluble molecule. Clear? Blood itself has a colloid. So colloids are the larger insoluble molecules like human albumin, dextran, then degraded gelatin polymer, hydroxy ethyl starch, polyvinyl, pyrrolidine, dione. So these are the different colloids. So one by one we'll see about the some of the important colloids which is used as a plasma volume expanders. Now coming to the first, albumin. Now albumin is a naturally occurring plasma protein. Clear? Albumin is a naturally occurring plasma protein. It obtained from the full human plasma. Clear? After getting the full human plasma, and 100 ml of the 20% of human albumin solution is the osmotic equivalent about the 400 ml of fresh frozen plasma or 900 ml of whole blood. So, if we are considering the osmotic equivalency, then we can say that 20% 100 ml, 20% of human albumin 100 ml, it is equivalent to 400 ml of fresh frozen plasma or 800 ml of whole blood. Next is it can be used without regard to the patient blood group. That means it may be see, if we are giving the whole blood, then there is a number of the things which blood group and all. But in that case, there is a no problem with the human blood group because we are giving the albumin. So that is the not at all a problem and does not interfere with the coagulation. So it will not having the any effect on the coagulation. Unlike whole blood or the plasma, it is free of the risks transmitting the serum hepatitis. Clear? Because the preparation of the heat treated. Because of the heat treated, there is a no risk of the transmission of the hepatitis. There is a no risk of the sensitization with the repeated infusion. So we are giving the repeated time also. More number of the time, there is a no risk of the sensitization. 20% of the solution draws and holds additional fluid from the tissue. Colloidal solution must be infused concurrently with the optimum benefit. So that is also it is important. Apart from burn, hypovolemic shock, etc., it has been used into the acute hyperprotemia, acute liver failure, and the dialysis. So it is used into the burn, hypovolemic shock, then hypoprotemia, acute liver failure, and the dialysis. Now, human albumin, it is increased the intravascular volume by 450 ml, but this expression depends on the blood volume, serum protein concentration, capillary permeability, and extravascular fluid ability. They do not confer any advantage of the saline aid respiration of the critically ill patient and should not be used in this. So, in case of the critically ill patient, they may not be useful. So, this is about the albumin, human albumin. Next, coming to the dextran. Now, dextran is a polysaccharide obtained from the sugar beet. It is available into the two forms. So, major two forms are the dextran 70 and dextran 40. For the dextran for 70 molecular weight is 70,000. It is more commonly used preparation and then it expand plasma volume for nearly 24 hours. So that is a long lasting plasma volume. It is for the 24 hours. It's slowly excreted by the glomerulus filtration as well as oxidized into the body overweight. So it will be slowly excreted by the glomerulus filtration as well as oxidized into the body overweight. Now dextran, nearly all the properties of the ideal plasma expander except. So accept this. Let accept this dextran having all other you can say that ideal property of a plasma volume expanders which we have already discussed in our first video. Now what? But it is problem is It may interfere with the blood grouping or cross-linking. That is one problem. Though the Dextran is clinically not antigenic, but its structure is similar to the antigenic polysaccharide. So you can say that some polysaccharide reacting antibodies, if present, because they are in the similar structure, if present, may cross react with Dextran and trigger anaphylactic reaction. So that is also a problem. Now different allergic or the hypersensitivity reactions which is occasionally occur, and though the anaphylactic shock is rare. As already you have told, they may also use interfere with the blood grouping and the cross linking, but it can also interfere with the coagulation and platelet function, thus prolonged bleeding time. So it will increase the bleeding time, so should not be used into such condition where you can say that there is a risk of the that is the bleeding, or you can say that bleeding is there. So in such condition it should not be used. Now, in case of the Dextran 40, it acts more rapidly than the Dextran 70, reduces the blood viscosity and prevent RBC slugging that occurs in the shock by coating them and maintaining their electronegative charge. So that is also important. Microcirculation may be improved. However, it is rapidly filtered at glomerulus, so it is not a long term. You cannot use for the long term. It expands plasma volume for the shorter period and may get highly concentrated in the tubule if in case of the oliguria develops. Now tubular obstruction may occur. So in that case, you can say that in such condition, tubular obstruction may occur. So total dose should not be exceed 20 ml per kg for 24 hours in 24 hours, and it can be stored for the 10 years. It are cheap and most commonly used plasma volume expanders. Now coming to the polygalen, that is the degraded gelatin polymer. It is molecular weight is almost 30,000, which exert the oncotic pressure similar to the albumin. It is also not antigenic. Hypersensitive reaction very rare, but it should be watched for. Clear? It should be watched for the any hypersensitivity reaction. Generally means it does not interfere with the grouping or the cross matching with the blood and remains stable for the 3 years. Clear? 3 years. It is also not metabolized into the body. That is very good, and secreted slowly for the kidney. And expansion of the plasma volume, it is last for the 12 hours. So this is, you can say that good, but it is more expensive than the Dextran, and it can be also used for the priming of the heart, lung, and the dialysis machines. So this may be occur. Though the hypersensitivity reaction is rare, but flashing, rigor, wheezing, hypotension, urticaria, these are the things it may be occur. Next is hetastarch. This is a complex mixture of ethoxylated amylopectin of various molecular size, and average molecular weight is 4.5 lakh. It is a colloidal property of 6% hetastarch, approximate those human albumin. So that is also important. Plasma volume expands slightly in excess of the volume infused. So what is the volume infused? After that, the plasma volume expands slightly, and that is the hemodynamic state has improved for 24 hours or more. But it is incompatible with many drugs, or no injectable drug should be added to the infusion. So whenever we are giving, should not given with the other drug as the infusion. Blood grouping and the cross matching may be vitiated. Now, small molecules are exerted rapidly by the kidney, and 40% of the urine dose appears in urine in 24 hours. So larger molecules are broken slowly. What are the larger molecule present in this, which is broken slowly, and smaller one eliminated with the behalf of 17 days. So these are the different types of the plasma volume expander used commonly.